Water fluoridation is not a conspiracy. It's a policy. It's a policy that's protected by the United States EPA and the FDA. It's a policy that is promoted by the Center for Disease Control, the United States Public Health Service, the American Dental Association, and the American Medical Association. They're using hazardous waste and adding it to our water supply because they've got a lot of it to get rid of. There's no reason for it. It doesn't do anything to improve the health of this country, and I believe it's destroying the fabric of our nation.
In spite of the science becoming more and more solid, irrefutable, that fluoride causes real problems such as osteosarcoma, it causes a loss of mental acuity, and in combination with lead is probably far worse than either alone. No one has taken the responsibility to reevaluate what the levels of either should be in drinking water. I don't know exactly how I would attack that, but it appears to me, when the lead was looked at, that there was no level at which lead did not produce an adverse effect. And I expect the same is true of fluoride. So you would put them together. My guess is it isn't just additive, it's multiplicative. But nobody is willing to do the study to determine what actually happens. There are lots of reasons to believe it's occurring nationwide, based on the LSAT studies in which the children are doing more poorly now than they were in the 50s before fluoride became much more widespread in its use. And this is very, very bad because the number of children who become adults whose IQs are above 120 is significantly reduced, and that's a terrible loss to the country.
Why are our children dying at such a high rate? Why are our elderly dying at a faster rate and at younger ages than people in 28 other countries, when we supposedly have the best medical care in the world? There's something dramatically wrong, and I think what's dramatically wrong is the approval of using things like mercury in fillings, which have been eliminated in Sweden, fluoride in the drinking water, the absurd use of extreme vaccination. I mean, we have more than roughly 4 times the vaccines being given in the United States to prevent death from infectious diseases of countries that have probably 1/3 our infant death rate. If all of these things worked, if amalgams were so good, if fluoridation prevented caries, if vaccines prevented death from infectious diseases and caused infants to live longer, we would have one of the lowest infant death rates in the world, and in contrast, we have one of the highest.
In a series of experiments in 1978, Schubert showed that if you take enough mercury to kill 1 out of 100 rats, 1 out of 100 rats dies. And if you took enough lead to kill 1 out of 100 rats and diluted it by 20-fold, that none of the rats died. But if you added the lead, an infinitesimal amount, 1/20th of an LD1, and the mercury, an LD1, together, you killed all the rats. That makes mercury and lead together hugely synergistic. Well, when you put silicofluoride in the water supply, you're giving the baby lead. And when you have vaccines with mercury in them, like the flu vaccine, you're giving them mercury. So the water supplies of this country are contaminated with silicofluoride intentionally by a government program. That needs to stop. It's poisoning the babies.